Okay, thank you, Gurpreet. So, hi, my name's Dr. Sarah Pontefract, as Gurpreet said, and I'm a lecturer in clinical pharmacy and therapeutics here in the School of Pharmacy at the University of Birmingham. Thank you for joining me today for this pharmacy taster session. So I hope that in this session I can provide you with an overview of how teaching is integrated across subjects in Birmingham. This will include professional practice, the science of medicines, health, disease and therapeutics, and chemistry. And I hope that the taste will allow you to see the type of practical activities you will undertake as an MPharm student at the university. I realise demonstrating practical activities is quite difficult when being delivered virtually, but I'll try my best. And also, I hope that you can appreciate the skills and qualities required to be a pharmacist. So this session, like much of our teaching, is based around a patient case, and this is of a 10-year-old boy. And throughout this session, you will have a few poll questions come up as multiple choice questions. So some interactivity for you to answer some questions as we go along. There'll be 3 during the session and also 3 at the end. So just interact with those polls as they appear. Okay, so as I said, this taster session is based on a patient case of a 10-year-old boy who presents to the community pharmacy with his mother for a prescription for an EpiPen auto-injector. The prescription is shown here on the right, which you'll all be familiar with that type of prescription. It's a green FP10, that's what they call them. It's an NHS prescription which has been issued on this particular occasion by a general practitioner. So this is for Thomas Shaw. It's a fictitious patient. He lives in Birmingham. He's been prescribed an EpiPen auto-injector, 300 micrograms in 0.3 mils, to be taken or given as directed, and for 2 auto-injectors to be supplied. So let's have a little think about the medicine that's been prescribed then. So a question for you all: which one of the following drugs do you think is contained with the EpiPen auto-injector? Do you think it's adrenaline, chlorphenamine, insulin, or salbutamol? I'll launch that now for you, and fingers crossed it will work. The votes are coming in. Okay, I'll end it there and share the results. Good. Okay, so just under, if you can see that, can you all see? Hopefully just under, say, just under 2/3 of you, so 60% got it correct, that the answer is adrenaline. So the EpiPen auto-injector contains adrenaline. Chlorphenamine is an antihistamine, typically given orally in the community setting for allergy. Insulin is a hormone given for the management of diabetes, and salbutamol is typically given as an inhaler for the management of asthma. So let's have a think about adrenaline a little bit more then. So if you're doing biology, which many of you will be, you will associate adrenaline with the fight or flight response. So adrenaline acts on alpha and beta adrenergic receptors. And in the fight or flight response, it stimulates the autonomic sympathetic nervous system. And in doing so, it increases blood flow to muscles, increases speed and force of the heart. It relaxes bronchial smooth muscle in the lungs and increases glucose levels in the blood. So if you think about how you have to respond to a pressured, stressful situation, you need all of those factors to be happening. You need increased blood flow to muscles to run faster, increased speed and force of the heart to pump more blood around the body. You need your to be able to take on more oxygen in the lungs for that to go around the body, and also to increase glucose levels for energy. So the adrenaline auto-injector, in this particular case the brand is EpiPen, is prescribed for patients who are at risk of anaphylaxis. Now, anaphylaxis is a severe and life-threatening allergic reaction, and the EpiPen contains a single dose of adrenaline for use in an emergency situation. So anaphylaxis is a state of acute physiological instability, and it's caused by too much histamine in the body. And adrenaline is the only treatment for anaphylaxis. It basically corrects that instability of the body until the body can essentially reset itself. So allergy, we probably may all have had an allergy at some time in our lives. Generally though, they are mild symptoms. So some of you may currently be suffering, for example, from symptoms of hay fever. So allergy is a spectrum of diseases, and true allergy, which can lead to anaphylaxis, is called type 1 hypersensitivity. which causes the classic allergic reaction that we may all know or be able to name a few symptoms of. Most type 1 hypersensitivity reactions occur within minutes of being exposed to an allergen, such as a nut, for example, or a nut protein. IgE, so an immunoglobulin E, is generated specific to an antigen, such as that you'd be allergic to, such as a nut protein. And this immunoglobulin E binds to receptors in mast cells, leading to mast cell degranulation, causing a surge in histamine release. And this is why in type 1 hypersensitivity reactions, they happen within seconds or minutes of being exposed to that allergen. So let's have a look at this graph. This graph shows the course of type 1 hypersensitivity. At time 0 is when exposure to the allergen occurs, and histamine raises within minutes, causing vasodilation, so dilation of the blood vessels. And that leads to flushing. It leads to fluid leaking out of the capillaries, which causes swelling, such as the lip swelling or the swelling of the tongue, and can also lead to itching. Another mediator is also released, which is called mast cell tryptase, and that peaks at around 2 hours. The mast cell tryptase is actually something that we can test for in the hospital setting. So if a patient was admitted to hospital having suffered a potential allergic reaction, the doctors would measure the mast cell tryptase to see if the patient has had an allergic reaction and to double check that that mast cell tryptase is falling gradually over a 24-hour period. So we know then that EpiPen contains adrenaline, and we know why it is given, so given for anaphylaxis to correct that physiological instability. So let's have a think then about how it's administered to patients. So another question for you. Which one of the following is the correct route of administration for an EpiPen? Is it orally, so given by mouth, intramuscularly, given into the muscle, intravenously, so that's given into the vein, or subcutaneously, given into the subcutaneous tissue? I'll launch that poll now for you. It will come up in a second, being slow. This isn't the opportunity to be Googling the answer either. Oh, it doesn't want to work, does it? Let me try again. I think it was just about to come up then as I stopped it. Good. Okay, I'll end the polling there and share the results with you. Excellent. Okay, so 74% of you got that correct. That the drug adrenaline given via the EpiPen is given intramuscularly, so it's given into the muscle. So it wouldn't be given orally because as a result of the enzymes in the stomach and also metabolism in the liver, adrenaline is almost totally inactive if it's given by the oral route. And adrenaline acts really rapidly after it's given into the muscle, but also into the subcutaneous tissue. However, the subcutaneous tissue isn't really used as a route of administration in this particular instance because absorption can be a bit slower. And if you think about the circumstance under which the EpiPen would be used, which is a medical emergency for anaphylaxis, you want it to be a really rapid absorption that's reliable, and therefore the intramuscular route of administration is the one that we use. So intramuscular injection then is the administration of a medicine as a solution or a suspension into the muscle tissue. And the needle bypasses the subcutaneous tissue, so just under the skin, and goes directly into the muscle. The volume that can be administered into the muscle at any one time is around 1 to 3 mils. And any more than that, the injection would be very painful for patients. Therefore, when you think about formulation design of medicines, you have to think about the fact that for an intramuscular injection to be a viable route or option for administration, the drug dose must be able to be administered in relatively small volumes. So medicines given via this particular route, so via the muscle, have a very rapid onset of action, and this is because the muscles have a very good blood supply. So let's have a look at where an intramuscular injection may be administered. So you may associate intramuscular injections more often with the upper arm, with vaccinations, for example, so the flu vaccination. But you may also associate vaccinations with the upper thigh, but also into the buttocks. So which one do you think, the EpiPen auto-injector, which site do you think it should be administered into? So let's Sorry about this. I'm going to launch that poll. Which one of the following intramuscular sites of injection should the EpiPen be administered? Sorry if I'd left that question up there. I don't know if you could have seen the slide. Okay, great. Share results. Good, again, so around 3/4, so 76% of you got the answer correct. So the answer is the outer thigh. So adrenaline is administered by the outer thigh. It's not recommended by other muscles because of possible differences in absorption. So blood supply here is good in the outer thigh, and therefore absorption is rapid, reliable as well. So let's go back to our patient case. So now we know what an EpiPen contains. So it contains adrenaline. We know what it is for, and we know how it works. Let's think more about the prescription request. So a pharmacist is responsible for the safe supply and legal supply of medicines to patients. And therefore, when presented with a prescription, a lot of work is done to determine whether the prescription meets the legal and ethical and safety requirements for the patient. In order to do this, some questions may well need to be asked of the patient or the prescriber before supply. And this is something that we teach our students throughout the teaching of years 1 to 4, thinking about the questions we might need to ask of the patient or the prescriber, and having those, being able to communicate effectively to ascertain that information. So let's have a think then about the types of questions we might want to ask this patient. So a good question to ask first actually is, has the patient used the EpiPen before? Just because this is the first time the pharmacist has seen a prescription for this patient, this doesn't mean the patient hasn't been prescribed it before and usually takes their prescription elsewhere. So determining whether or not it's a new prescription completely or whether this is a resupply of an existing prescription. What is the patient allergic to? So this is important to determine if the prescription is necessary. If this is an allergen that can be avoided, such as a drug allergen, such as a penicillin, then the EpiPen is probably not required. However, if this is an allergen where accidental exposure can occur outside the control of that person, such as with a food allergen, and that can put them at risk, then the EpiPen or an adrenaline auto-injector would be indicated, so it would be necessary. What kind of symptoms did the patient experience? So this may also initiate a conversation about any tests the patient has had to also confirm the allergy. So the patient or the patient's mother in this particular case may be able to report the symptoms that she or he, the child, experienced at the time. And these tend to vary in severity, but they tend to affect the skin, the gastrointestinal symptoms, respiratory, cardiovascular systems such as a raised heartbeat or low blood pressure, and also neurological symptoms such as anxiety. People who suffer from anaphylaxis report this feeling of impending doom just prior to that reaction coming on in its intensity. So many people experience a difficulty in swallowing or speaking, and of course swelling of the throat and mouth. Both of these can compromise the airway, which is why it's a medical emergency. What else might we like to ask? Well, has the patient been shown how to administer the injection? The patient may well have just come out of a consultation in an outpatient setting with an immunologist, for example, who would have recommended or even tested for the allergy in the first place. So ascertaining their baseline knowledge is a really important part of the process. Also, has the family been shown how to administer as well? This is particularly important for a child because it may well be that the mother or father or parent, guardian, carer would be administering on behalf of the child. But also, irrespective of that, adults and their family would also need to be shown how to administer the EpiPen in an emergency situation. This is a child as well, so 10-year-old, and as much as the fact that most people aren't in school very much at the moment, typically this child will probably be in school, and therefore they need to inform the school about the allergy. So ascertaining whether or not the patient has informed the school and finding out whether or not they are aware that they can purchase adrenaline auto-injectors without a prescription from a community pharmacy. So they can do this so that they can keep the adrenaline auto-injectors within the school environment for emergency situations, such as with if the child forgets their own adrenaline auto-injector or if their own fails to work at the time. Also, people in the school need to be trained on how to administer that particular injection as well. Okay, so having ascertained some information, we have some baseline knowledge about their knowledge about the adrenaline auto-injector. Then we can start to think about the legality of prescribing. So something that we teach our students about is about the legal and ethical supply aspects of prescribing and administration of medicines. So pharmacists have the legal authority to supply prescription-only medicines, and this is always done in line with the medicines and the human medicines regulations. In professional practice, we teach students the legalities surrounding all of prescriptions and the varying different types of prescriptions. And all prescriptions must fulfil specific requirements in order for the pharmacist to be able to supply the medicine. So the prescription must state the following particulars. So a prescription must always state the patient's name and address. So here we have our fictitious patient, Thomas Shaw, who lives in Birmingham. We have a patient's name, patient's date of birth, and or their age if they're under 12. So we see here he's 10 years old and we have a date of birth. The prescription should state the name and the address of the prescriber. So here we have a prescriber and the address of the surgery. And also it must be signed and dated within 6 months. So here we have a signature and it's also dated just a few days ago. In addition, the prescription must also be written in indelible ink. So that means that the ink that's used mustn't be able to be rubbed out, and that prevents any kind of fraud or amendment to the prescription. So when we're satisfied that the prescription is legal, which all of those elements were there, we would then consider whether or not actually it's appropriate and safe for the patient. So we would need to check basically now whether or not the dose is appropriate for the weight and or the age of this patient. So we teach our students how to use a lot of online databases, and the British National Formulary is the one which will be accessed most frequently. So this is a database that's used by most healthcare professionals, and it has all the information needed about medicines that are licensed in the UK. And here I've summarised the dosing recommendations from the British National Formulary for an intramuscular adrenaline given as an EpiPen. And here it states that a child with a body weight of 26 kilos and above should be prescribed a 300 microgram dose. You can see it's highlighted there. And this 300 microgram dose can be repeated after 5 to 15 minutes. Now, the average weight of a 10-year-old is around 32 kilos, and the BNF will also tell us this information if you weren't aware of that. It wouldn't necessarily be required to weigh the patient in the consultation room. It may be that you are aware of what an average height and weight of a 10-year-old would be, and you're quite satisfied that you feel that child is over 26 kilos. However, if you're unsure, then of course a patient could be weighed in the consultation room to double check that the dosing is okay. So in this particular case then, because the child will probably be around 32 kilos, the dose of adrenaline would be correct. So I'm satisfied that the dose is appropriate for the age and or weight of the patient. The next thing to check is that the prescriber has specified the brand of auto-injector. Now there are around 4 different brands of EpiPen adrenaline auto-injector, of the adrenaline auto-injector now, and all of them have a slightly different administration technique. And so providing a different brand could mean that the patient can't activate the adrenaline auto-injector at the time when they need it in an emergency. And also they run the risk of injecting the adrenaline into their thumb. So the brand must always be stated, and on this prescription, EpiPen is written there, and that's the brand name. So again, I'm satisfied that the prescriber has specified the brand. And finally, all patients should carry a spare auto-injector. So you saw in the dosing guidelines that the adrenaline auto-injector can be repeated after 5 to 15 minutes. And therefore a spare auto-injector needs to be available to the patient in order to give that second dose. So here, the doctor has prescribed 2 auto-injectors. So again, I'm satisfied from a patient safety point of view, this prescription is okay. So now let's have a think then. So we've ascertained what they already know, and we've checked that the prescription is legal and it is safe for the patient. And now we will need to provide information back to the patient when we hand out the drug and supply the drug to them. So let's have a think about the type of things we might like to say. So demonstration of how to use the device. So they may have already had an understanding from the doctor or the nurse but actually reiterating that information and revising and clarifying that they're aware of the information and what they know is correct is a good idea. Storage and expiry of the device. So the EpiPen should always be carried in its hard case to protect the EpiPen from light. So it must always be carried in this little carton, and also it shouldn't be stored above 25 degrees, and it shouldn't be stored in a refrigerator or a freezer. Both of these things can affect the stability of the adrenaline, which may therefore render it ineffective. It's important to tell the mother and the child to look in the little viewing window of the EpiPen on a regular basis, just to double check that the solution is clear and colourless. If it's dark, cloudy, or has any specks floating in it, then it needs to be ensured to be replaced. Again, as well, you can reiterate to the patient and the patient's mother in this case that access to a spare auto-injector is required at all times. Disposal of the device. So you can discuss this. It's quite important considering the fact that the adrenaline auto-injector contains a needle, and also that the adrenaline auto-injector after administration will still contain some drug. So therefore it needs to be disposed of as pharmaceutical waste. So the best way to do this would be to give it to a pharmacy, to put into the pharmaceutical waste bins, or to give it to the ambulance service. And finally, providing any guidance for parents about and the school in relation to the emergency situations and access to EpiPens. So to ensure the school is aware they can purchase the adrenaline auto-injector, that they can keep it on the premises for emergency situations, and to ensure that staff are trained appropriately. So now then, let's have a look at how the EpiPen should be administered, so we can start to have a think about exactly the information we would tell to the patient.
Someone experiencing anaphylaxis should be placed in a comfortable position. Most people will lie flat. People having breathing difficulties should sit up. Pregnant women should lie on their left side, and people who are unconscious should be placed in the recovery position. To remove your EpiPen from the carry case, flip open the cap and slide the EpiPen out into your dominant hand. Keep your fingers and thumb away from the orange shield as this contains the needle. With the orange shield facing down, pull off the blue safety release. Holding the thigh still and with the EpiPen auto-injector about 10 centimeters away from the thigh, with the orange tip pointing towards the thigh at a right angle, jab the EpiPen onto the thigh and hold in place for a full 3 seconds. A clicking sound will indicate that the device has been activated, as it is spring-loaded. You don't need to remove clothing, but avoid putting the needle through seams, buckles, or zips. When administering the EpiPen to a child, ensure the child's thigh is held still to avoid the chance of local tissue injury. After administering the EpiPen, you or someone with you should call 999 immediately, even if symptoms are improved. The person who has the anaphylactic reaction should stay lying down or seated on the ground. The patient should try and avoid standing up during anaphylaxis. Make a note of the time the EpiPen auto-injector was used. If there is no response in 5 minutes, use a second EpiPen auto-injector if available. The MHRA guidelines are for 2 EpiPen auto-injectors to be carried in case additional doses of adrenaline are required. The patient will then need to be assessed in hospital in case further treatment is required. There is evidence that some patients may experience a second reaction sometime after the first.
Okay, I'll leave it there. So that basically summarised some of the key points that we would discuss with the patient in relation to the administration of the EpiPen. So having provided that information and also giving the patient information as to the websites they can go to, reputable websites they can go to for example, to look at that video again, and that's the one that's come particularly from the EpiPen company. It's important then to end the consultation appropriately. So one of the important things to do before the patient leaves your consultation room and leaves the premises is to confirm that they've understood everything that you've explained to them. So that's the patient, and also in this case, the patient's mother. It's useful to ask the patient and the patient's carer, and the mother in this case, to explain how to use the EpiPen back to you. So we'll ask them to train you now on how the EpiPen should be administered. And this provides you with the opportunity to identify anything they've got incorrect or that they may have misunderstood. You may also want to explore any concerns that the patient may have, and also the patient's mother. So this is a child, so the child may ask questions such as, does the EpiPen hurt if it's administered, or will I have any side effects as a result of administration? And finally, there will be the supply of the EpiPen auto-injectors. And we take our students, of course, in the professional practice labs through the process of dispensing to ensure, again, that that is a legal supply and it's appropriately labelled for the patient. Okay, so that's the end of the taster session. However, no degree will let you escape without having an assessment as an integral part of the process so that we can see what you have learned. So just a few questions then for you to end with. So question 1, how far away should the EpiPen be held to the thigh prior to administration? Is it directly against the thigh, 5 centimetres away from the thigh, 10 centimetres away, or 15 centimetres away? Okay, great. I'll share those results. So 88% of you got that correct. The EpiPen should be held 10 centimetres away from the thigh. Next question, how long should the EpiPen be held against the thigh for after administering the adrenaline? Should it be removed immediately after administration, 3 seconds, 5 seconds, or 10 seconds after administration? Okay, good. So again, majority of you got that correct. So the EpiPen should be held in place against the thigh for 3 seconds. Now, for those of you who selected 10 seconds, you may well know someone who uses the EpiPen auto-injector. And this is the importance of keeping up to date as pharmacists. So the guideline has only just changed within the last couple of months, and all the EpiPen packaging will change shortly to say that it's changed from 10 seconds to 3 seconds. So 3 seconds was the answer there. And after administering the adrenaline, which one of the following actions is correct? Should the patient wait to see his symptoms improve? Should they get transport to the emergency department? Should they call 111? Or should they call 999? Okay, and Claire, great. Well done, so 93% of you got that correct. So it's really important that you call 999 after the first dose of adrenaline is given, or it may also be done at the same time with somebody administering the adrenaline and someone else making that phone call. But it's essential that the 999 is called and you go to hospital to be checked over. As it said in the video, there is a risk that another anaphylactic reaction could occur. And also you need to be checked over for the fact that obviously you've had a dose of adrenaline, and therefore they would probably monitor your heartbeat and possibly put an ECG on you to check that you're okay following the administration. So that's the end of this taster session, whistle stop tour. I hope I provided an overview of how teaching is integrated across subjects in the School of Pharmacy. So we did a little bit of biology there in terms of the immunology, discussing type 1 hypersensitivity. And also we did some science of medicines where we discussed about formulation. Also we did some professional practice there as well, and touched on a little bit of chemistry when I spoke about the stability of the drug and having to keep it in its carry case because it's sensitive to light. I hope I've been able to let you see the type of practical activities you'd undertake as an MPharm student. Now, of course, in the lab setting, we would have students working together, counselling each other on how to use the EpiPen, and we would give our students trainer devices to do that. And also, I hope I've allowed you to appreciate the skills and qualities required to be a pharmacist, both in terms of the communication skills and also the skills required to acquire information, gather information, and use that effectively. Thank you, and I hope you enjoyed that session.
Thank you. We just do have some questions